Good evening, doctor.
Good evening.
I hope you're doing well.
Yes, I'm good. Thanks. How are you?
I'm all good. Thank you so much for asking. And good evening to all the people who have joined us and who will be watching our session. We have Dr. Nishtha with us who will be sharing her insights on the topic coping strategies for anxiety and stress. Doctor, can you please introduce yourself with the audience?
Hi. Hi, everyone. I'm Dr. Nishtha Dalwani. I'm a consultant psychiatrist and psychotherapist practicing in Mumbai since the last 25 years.
Right, ma'am. Thank you so much. So, ma'am, I guess we can start with the conversation.
Sure.
Okay, so we'll start some very basic questions first. So, what are some effective ways to manage stress in our daily life?
So, routine is the key to handling stress. So, we all have to establish a daily routine that includes time for work, relaxation, and activities that we enjoy. So, physical activities like walking, aerobics, gymming, swimming, anything that you like. All these activities increase our brain endorphin levels, which are the happy hormones, and they make us feel good and improve our mood. Second is diet. Having a diet which is rich in fruits, vegetables, whole grain meat, and fish reduces the incidence of depression by about 35%. Maintaining a good glucose level by eating at least every 2 hours prevents mood swings. Ensuring that you have a good quality of sleep, so at least 6 to 8 hours every night with good sleep hygiene. So, sleeping at the same time every day and getting up at the same time. No using of gadgets half an hour prior to sleeping and after waking up. Abstaining from alcohol, recreational drugs, meditating, doing yoga, deep breathing exercises, and mindfulness therapy helps. Also, developing some creative hobby and a strong, good connect with family and friends goes a long way.
Right, ma'am. Thank you so much. So, ma'am, moving towards my next question. So, how can individuals identify their personal triggers for anxiety and work towards addressing them even in a more effective manner?
Yeah, the technique that we psychiatrists do in our private practice is cognitive behavior therapy. Now, cognitive behavior therapy is the mainstay for patients who suffer from anxiety and depression. Now, in cognitive behavior therapy, we ask our patients to do a journaling of their thoughts, emotion, and behavior, which there helps them to identify their triggers for their stress and anxiety. So, in CBT, that's cognitive behavior therapy, there is A, B, and C. So, A is the activating event, so the event which has happened in your environment. B is your belief system, that is your thoughts or your reaction to that event. And C is the consequent emotion that you experience. So either you can have a negative emotion like sadness, anxiety, fear, guilt, panic, or a positive emotion like peace, happiness. So cognitive behavior therapy helps us change our irrational thoughts into rational ones so that we can get a positive desired emotion. So CBT focuses on challenging and changing the cognitive distortions in our thoughts, beliefs, attitudes, and behavior to improve our emotional dysregulation and develop good coping strategies to handle stress and the current situation.
Okay, ma'am. Thank you so much. So, ma'am, my next question would be towards basically talking about techniques that can actually help us in effectively managing stress. So, are there any mindful techniques that you suggest to your patients that can be helpful in us, like in our daily lives, also for reducing stress?
Yeah. So 5 minutes of mindfulness therapy is very important. We could practice it this early every morning when we get up. The whole idea is to put back the emotional baggage of the previous day and get up and start facing the new day with a lot of positive emotions. In this technique, you have to just sit, close your eyes, and just accept the present moment and use all your energy to directly handle the situation on hand. So we have to get in touch with all our senses. We have to be consciously aware of our thoughts, emotions, behavior, as well as of our surroundings and of also the people around us. We also teach our patients techniques like non judging, patience, accepting things, forgiving, forgetting, and practicing gratitude. There are also relaxation exercises which I teach my patients. So they are the deep breathing exercises. So deep breathing involves inhaling. So when you inhale, you count 1 to 5, then you hold your breath, you count 1 to 5, and then a gradual exhalation. So when you exhale, you count 1 to 5. This technique helps in calming the mind. So 10 minutes of deep breathing in the morning and night goes a long way in handling stress. The other technique is Jacobson's progressive deep muscle relaxation. In this technique, the patient is taught to alternately contract and relax the muscles of the body so as to reduce the physical anxiety.
Right, ma'am. So, ma'am, other than the techniques that you've just mentioned, are there any other specific strategies you have found helpful in that can help us in bouncing back from the setbacks or the difficult times that we usually face?
Yes, every experience teaches us something. So, any negative setback, we have to learn from that. So, first of all, I tell all my patients, who come to me in the clinic, accept. When you accept there's a problem, 50% of the solution is achieved. So,
Right.
acceptance, you recognize that these setbacks are temporary and we have to learn from them. And it's part of our growing. Seek support. So when mental health comes, people are very reluctant to approach anyone. They keep it. When there's a physical problem, immediately we contact a doctor. But when there is a mental health, the stigma attached still, reluctance to take medication is plays a very strong role even in the current scenario. So don't hesitate to seek support whenever there is a
Right.
setback. You can talk out to a close friend, talk out to your relatives, approach a counselor, approach we have there are psychiatrists now who can help you out with these problems, both with medication and even without medication. There are so many other techniques which can be taught to help you come out of this problem. The other thing is learn and adapt. You have to use these setbacks as learning opportunities to strengthen your coping strategies. One has to develop our personality, which is very important. We learn how to mature in the process. Age is not a sign of maturity. Nowadays, I see very many youngsters, come to my clinic and they are much, much mature before age because they have handled so many setbacks in their life and they have come out
Yeah. Yes,
done
yes.
very well.
I can relate to that.
Yeah. So the other thing is we have to improve our resilience and we have to learn to develop better coping skills so that we can achieve the goals that we have set forward for ourselves in our lives.
Okay. Rightly said, ma'am. Thank you so much. So, though I don't want to end this, but we have last question now with us. So, how can individuals strike a balance between self-care and professional life when dealing with mental health challenges?
It is very important to set the boundaries and one has to prioritize our well-being. In the current scenario, we see that we all are hard pressed for time. We have so many commitments professionally as well as household. So I
Yeah.
have a lot of working ladies who come into my clinic and they're not able to balance both, their work life because nowadays there's so much of stress at work. We are seeing so many layoffs happening in the professional world as well. And people are losing jobs. There are so many stresses, so much of competition, so they have to handle that plus the pressures of personal life, interacting with the family, social network. So it's very important to take regular breaks. I advise all my patients, we often miss out on that. So take breaks once in a while, go for a vacation every weekend, give yourself, have that me time, wherein you're just with yourself and you do these therapies which I told you, like mindfulness, relaxation, which is very important to recharge yourself to face the next day.
Right.
Because if you don't unwind, then you're not fresh for the next day and for all the challenges that it comes up with. So one should focus not only on our physical health. I see patients doing all blood tests, every year they do it, but nobody focuses on the mental health. So it's very important to focus. Also, we have to set realistic goals that we can achieve. So we don't have to put too much expectations on ourselves as well as on our close people. We have to switch off from work when we are at home. So very often in my practice, I'm seeing patients who come with so many psychiatric mental problems. So it's very important that I switch off when I come back. So all of us should do that. Don't carry the work tensions home because then it will affect your interpersonal life
Personally.
with your
Right.
spouse, with your children. So we become, and then we use that displacement technique. The boss screams at you when you come home and then you scream it on your child or your spouse. Develop some creative hobbies, whichever is of your choice, which you can do at least once a week, like music, painting, reading books, or learning any new instrument. Have good time management skills, which is very important, so that we can have a good, healthy life work balance.
Right, ma'am. Very nice tips. I hope that the people who will watch this session really can have a can make a change in their life. It was really very impactful session. By the way, do you have anything from your side other than the questions that you want to convey?
Yes, just a simple message. The dictum I follow in my life, I would like people also to do the same, is the best attitude, best. So B stands for breathe well, E stands for eat well, S stands for sleep well. And if you do all these three, that you breathe well, eat well, sleep well, automatically you'll come to T, that you will think well.
Think well. Right. Very nice quoted. That's a very nice quote. Thank you so much again, ma'am. It was really very pleasurable for us to have you here. Thank you so much again.
Thank you so much for having me here. Yeah,
It's
right.
really a
Bye
pleasure
bye.
for us. I really hope you have a great day, ma'am. Thank you so much.
Thank you so much. Bye
Stay
bye.
healthy and take care.
Take care. Bye bye.
Bye.